The next pharmacokinetic parameter we're going to discuss is distribution. And here we're looking at how the drug distributes throughout the body. Okay, and of course this distribution really relies on the perfusion. And so the greater the perfusion of blood to a specific organ, the greater the distribution of that drug. So this introduces kind of a new concept called the volume of distribution, termed VD. And essentially this is the size of an imaginary container that is required for the total amount of the drug in the body to be dissolved. Okay, and so the volume of distribution is typically described as the amount of drug in the body over the initial drug concentration. Okay, in terms of IV administration, it's really the dose divided by the plasma concentration, and it is a volume. So this is what the distribution pattern looks like for a normal, 70 kilogram person. So a 70 kilogram person will have about 40 liters of total body water, and that's about 60% of the water that's in their system. And that 60% can be further subdivided into the extracellular and the intracellular compartments, and with 14 and 30 liters respectively. The extracellular portion can be further broken into the intravascular space, including the intravascular plasma and the intravascular blood, as well as the interstitial fluid. And so here, within these intravascular compartments, we're dealing with the concentration or the ratios of free drug versus bound drug. And so the volume of distribution is actually an apparent volume of distribution, okay? And it's the proportionality constant that exists between the dose of a drug and the initial starting plasma concentration. Okay, and mathematically this is what it looks like. And we're going to use the volume of distribution for the pharmacokinetic calculations that are at the end of this chapter. The smallest possible volume of distribution is about 3 liters. That's a plasma volume, but there is no upper limit. Okay, so what does that mean? Well, earlier we said that the volume distribution is about 40 liters in terms of total body water, but some drugs have a volume of distribution of 1,000 or 500 liters, which doesn't physically exist. So what does this mean? Well, think of it in terms of the amount of water that's needed to solubilize the drug. So if you need lots of water, the drug is very lipophilic. It behaves like oil and vinegar. These two things do not want to combine, and it takes copious amounts of water to dissolve even a very small amount of oil. On the flip side of that, something like table salt would require very little water to dissolve. Okay,